My name's Romy and I had one too. So I guess the story started with finding out that I was pregnant, and that was definitely a surprise. My partner and I had been together for 3 years at the time, and were definitely in a space where we were feeling excited about having a baby, but definitely not quite ready yet. My initial reaction to finding out I was pregnant was one of excitement. I think it's something I'd always kind of looked forward to. And then we just sort of started the conversation, and I guess as the conversation continued, we realised that it wasn't quite as simple as just being excited, and there was a lot of other factors involved. It was a really painful and challenging 2 weeks of discussion and emotion and sharing it with our families and sort of trying to get guidance and support on making that decision. And eventually we came to the decision to have an abortion, and it was really hard to get to that point, and we were really unsure about it, but financially and sort of where our careers were at, it would have been incredibly challenging to go through with the pregnancy at that point. But at the end of the day, we totally had each other's back and were supportive of whichever one of us had more of a strong feeling about it, which we did. And so we oscillated between, carrying through with the pregnancy and then not. And then that whole thing was just really challenging on our mental state, I think. I think it's something that's, stayed with us to a degree, and we ended up becoming pregnant a year later at a time when we weren't financially in such a challenging spot, and that felt right. And our son's now 20 months and it feels like the right thing to have done, which is a relief, I guess. But it was definitely, without a doubt, the hardest thing we've ever been through together. So, until we had a child, that's definitely been harder, but it was at the time the hardest thing that we'd been through. And then came the thinking about how to go about the termination. So I went to see someone at family planning. I was living up in Darwin in the Northern Territory, and they were really great, really helpful. They took me through the processes, and it required me to have a discussion with them about what I wanted to do. I guess a counselling session with them. And the laws in Darwin, or in the Northern Territory at the time, were very restrictive in terms of access to, particularly to the medical termination, the tablet. That took some time going through the processes, and at the time you were required to see someone at the family planning centre for the counselling session, and then you needed to see 2 senior doctors at the hospital to okay you for medical termination. So this whole process took a number of days, probably about a week, and it really became apparent to me how challenging it was living in Darwin and speaking English, and how much more challenging that would have been for people who were living in Indigenous people living in remote communities, or people who don't speak English, trying to navigate that system. I was actually working as a midwife at the hospital, so it was quite easy for me to get the 2 doctors who I knew to say that was okay. If I was going to have the surgical termination, the recommendation, given a medical history that I had, was to leave Darwin, and I really didn't want to fly home back to Melbourne to have the surgical termination. So we decided to do the medical. And I took the first tablets and went home, and was called to a birth because I'm a midwife. So I went to work and I did a 12-hour shift birthing a baby, and came home after that and was a complete wreck emotionally and physically. I guess the pain and the nausea started, and it was a real shock to the system, because I was completely unprepared for, I guess, the symptoms and the emotional ride that was the termination. So there was never any discussion from anyone about what the actual process was going to be like. And maybe that's because I was a midwife and it was kind of a presumed knowledge, but it definitely wasn't a part of my skill set. So yeah, it really took me by surprise, the intensity of all of it. And it was over relatively quickly, probably within about 4 hours from when the pain started. But it was full on. It was a really intense time. And I guess I'm used to labour and birth where you have contractions that start and stop. And this was constant. There was no break. And I was living in a share house at the time, so it didn't really feel like the most private space to be doing that. But I definitely wanted to be at home rather than in the hospital. That felt like the right place to be. I was pretty appalled that something as big as just the decision whether or not to have a child was something that was made by policymakers and not something that could be made by the individual. And, you know, knowing how poor access to good quality healthcare is for the Indigenous communities, it really highlighted for me how this, the medical termination, the tablet, which would be the most appropriate for people living in community to take and remain with their family and on their land, that wasn't really accessible to those communities. Thankfully, law reform came through in 2017 and has made it more accessible, but it's still far from optimal. And so, yeah, I guess part of it's an appreciation that it was available, and then also just feeling really pissed off that it's, you know, there's still a lot of restriction and it's difficult for a lot of people to access.